Hello, how are you? Welcome to another session on nursing care case studies. In this segment, we're going to look at the different components of the nursing care case study. We're going to see which are these segments that we are going to focus on as we do or write our nursing case study. If you're new here, my name is Winnie Berawa, and this channel focuses on lectures, lessons, and expert interviews pertaining healthcare. Don't forget to give us a subscribe, comment, and share these videos in your platform. So let's go in and see what's there for us. So when it comes to the nursing care case study, we are going to look at different parts. And one of it we are going to explore in this particular series is part on introduction, which is going to carry details like the demographics, the data about the client. We're going to explore reasons for admissions. These are things like what has brought the patient to this particular facility for management. So it's going to help us determine the diagnosis. Then in the second bit, we're going to look at patient history. So this comprises a bit of our assessment. So we are going to ask history on different parts like the chief complaints, the history of presenting illnesses, medical surgical history, family history, socioeconomic history, drug and food allergies, and any other history that pertains to the patient. If it's a woman of reproductive age, we are going to explore things like obstetric history, gynecological history, menstrual history, any and any part. If it's a child, we may want to explore things around milestones, immunization history, history touching on their nutrition, and so on and so forth. So these are part of the components that will be catered for as we go through these parts and series. Then the other components that are key for us to know is about the physical examination. And in physical examination, we are going to do areas around how to conduct the head to toe exam, or how do you go about it, which parts should one prioritize, how should we put all these parts together, how do we bring them together until they make sense. And then we have other ways of doing physical exam like systemic examination, where we go through the different systems of the body and describe or rather physical examine it one by one, understanding the techniques that needs to be used and how to approach them. Then without forgetting, physical exam also caters for vital signs, it caters for investigations. So in here, in vital signs, we're going to look at the vital signs that are key based on the disease that you're looking at. If you're looking at respiratory, there's some basic vital signs that you need to work on. If it's a circulatory system type of physical examination, there are key vitals that you don't miss. And then we have investigations, and investigations, there are two categories. We have the basic or the routine investigations that are done for a client, and this could be lab works. And then we have specific investigations that are done relating to the disease that the client has done or the client has been diagnosed on. And then we have the other part of nursing assessment. So in nursing assessment, we're going to look at how do we identify the needs of the patient. So there are different ways of assessing a patient. You can use the general assessment where we generate cues and data that is going to help us manage this client. That is like priority needs kind of assessment. But we are also going to check on health patterns, which we normally call the Gordon's functional health patterns. So the Gordon's functional health patterns has 11 priority functional patterns that one has to look at as we are trying to understand the patient's needs. So you could explore, let's say, from circulation, you want to explore elimination needs, you want to explore mental needs or processing cognitive needs. So it's very broad for when it comes to Gordon functional health pattern. We'll do another session on just Gordon so that someone can understand how Gordon's functional health pattern assessment works, so that you see the different elements of Gordon's and the way you can assess them. And then on priority needs, this is quite general. You just check from the clinical manifestation of the clients, what are the key areas that one will wish to focus on. And the other bit about nursing case study is that we will do areas of nursing diagnosis, and in nursing, this is guided by the NANDA, or rather, this is guided by the NANDA guidelines, which provide the different nursing diagnoses that a nurse can focus on. And this is an area, again, if you're still stranded and don't know what to do about it, like you struggle with nursing process, struggling with the nursing care plan, we've given a special segment just to cover about nursing care plan. So just go to our playlist. You will see a playlist there talking about nursing care plan. So just go through those videos and you'll be able to be helped. And then we've got a segment in the nursing case study that explores the nursing interventions and the rationales. So we're going to look at the treatments, the nursing care plan, health education, discharge approaches, follow-ups, and all that. And then we got expected results and outcomes. So this looks at what is the outcome after the various management that were done to the patient. Are there areas that needs improvement? Are there areas that needs to be summarized? And of course, we will check other areas that are needed to be handled, like discussions, conclusions, and references. So all this will be put together now into a document, a written down document, what you can publish or we can use for presentation, and this is what you can call the case study. So don't worry, we're going to take this step by step so that you don't get confused. So we'll go all the way now to like compiling the real document. Which topics do you start with, subheading by subheading, until you get to understand how it's done. But for now, we are breaking down each simple bits into smaller segments so that we can all be on the same page. So keep it here. By the time we are done, you will really appreciate all these sessions. Thank you for staying with us all the way to the end. Don't forget to like, share, and also subscribe. Leave a comment if you enjoyed this segment. Thank you so much, and see you in our next lessons. Bye.